Hey guys, so in today's video, I thought that I would take some time to respond to a couple of different comments slash questions. And I believe these are both from the same person. So I just am going to read the comments slash questions and respond to them. So this comment was left on my video titled CNA Vlog Working as a Shower Aide. And this comment was left by Calbells555. And this person said, my question is, do nursing homes that you know of accept space heaters as donations to heat the shower rooms for patients? So in that video, I was talking about how a lot of the shower rooms when you're showering patients are actually cold. And, especially confused patients or patients with dementia have a problem because they don't understand why they're in this cold room being showered by somebody else and they're not able to do it themselves. And so that is why this person asked this question. And I just want to tell you that it is very nice of you to consider donating things like this, or even to think about making a donation to a nursing home or a long-term care facility. I will have to say that it would depend on the actual facility. So there are multiple facilities who may accept donations of space heaters. There are also facilities who, due to state regulations or laws, may not be able to accept donations of space heaters. So I would say that it's best to actually go to whatever facility it is that you're thinking of making a donation to and ask about whether or not they're able to accept a space heater. It may have to be a situation where if you donate something, it's going to have to go through their maintenance department so that they can make sure that it's safe. Because I know there have been multiple facilities where I've worked at who they would not allow space heaters in the residents' rooms unless it was an approved heater from maintenance. Like they had to have a safety protocol done by the maintenance department in order to make sure that it was safe for use in the facility. And then there were also facilities I worked at where no matter what, regardless, you were not allowed to have a space heater. Even if maintenance said that it was safe for use, they would not allow residents to have space heaters in their rooms. So like I said, I would check with the individual facility that you are thinking of donating to and see if that's something that they actually approve of or not. So I'm going to move on to the next comment slash question. And this one was left on my video titled, which is better, CNA or phlebotomy? And this is a longer question slash comment, so I'm going to look for the actual question that I wanted to address. Okay, so this one said, I have another question related to this video. Do you have CNA experience working in an inpatient rehab setting like the one you were in recently? I feel like I'm leaning towards that direction ultimately. So for those of you who don't know, I was actually in an inpatient rehab or on an inpatient rehab unit for almost a month. And that was due to paralysis on my right side, weakness on my right side. And all I was able to really do was wiggle my toes on my right foot. So that is where that is coming from. I was in the inpatient rehab unit for the amount of time that I was getting occupational therapy and physical therapy to try to help me become more independent and regain strength and mobility and function. So yes, I have worked in an inpatient rehab unit or on an inpatient rehab unit. It was located within a huge facility where they had assisted living, independent living. They had a locked memory care unit as well as a hospice unit, and it was a huge facility. And I just want to say that inpatient rehab is one of the places that I enjoyed working the most because I was able to see so much progress from residents. I didn't really work with any residents who were my age. It was the type of unit where it was usually elderly people who had either had a fall or some type of injury where they had broken a leg or an ankle or a hip, and they needed extra assistance getting back to a level of function where they were able to be independent in their homes. The unit that I worked on usually had people staying there for a longer period of time than what the unit where I stayed on would allow. So that is something else. It was more like a long-term care facility where you were on the rehab unit for a longer period of time, if that makes sense. But I absolutely loved watching people make the progress that they would be making. There were multiple people who started off in wheelchairs who, by the time that they left, they were using walkers. And that is something that I really want to be able to do for myself, is to be able to get out of this wheelchair so that I can transition to a walker, and then hopefully eventually transition to being independent and not needing these mobility aids that I need. However, I do understand that things happen where I might need a mobility aid of some sort, and I am totally willing to accept that. I just want out of this wheelchair. So I know that this wasn't a super long video. I would definitely recommend working on a rehab unit if that is something that you are looking into. Like I said, it's one of the only units in long-term care type of setting where you are able to actually be happy and see people make progress in the positive manner, because a lot of long-term care facilities or units that you would work on, people are there for the rest of their life, and then eventually you see them decline and then end up passing away, because that's just the nature of the beast, so to speak. So anyways, I hope this was helpful. This was questions left by the same person, like I said. So I hope this answered your questions. And yeah, if you guys have any other questions or topics that you would like me to address on my channel in the future, let me know. I'd be glad to get something filmed for you. And with that being said, I will talk to you guys in my next video.